Assalamualaikum warahmatullahi wabarakatuh. My name is Nuhazrani binti Anam. I am from University Technology Mara, Shah Alam, Malaysia. The title of my presentation today is about analysis of spatio-temporal gait parameters in chronic stroke survivors. So these are my slide content. It consists of 6 parts. So for the introduction, I would like to brief a little bit on stroke. What is stroke? Stroke is generally a brain attack, and it happens when there is no blood flow to part of the brain. And in statistics, in 2002, they rated that 11.9 per 100,000 population, which is Malaysian populations, were patients with stroke. And NASAM also highlighted that 40,000 Malaysians are disabled due to stroke every year. So recently in 2013, stroke was second most recurrent cause of death. And for your information, the complication of stroke can affect gait performance. For example, in spatio-temporal parameters. Now this is the stages in stroke. It consists of 3 stages. The first one is acute, subacute, and chronic. For acute stage, the duration is less than 1 month, and for subacute, the duration is between 1 to 3 months, and the worst one is at the chronic stage, where the duration is more than 3 months, and the disease is still ongoing. So basically, this research is focuses on the chronic stroke subjects. And the objective of my research is to investigate the spatio-temporal gait parameters among stroke survivors, and number 2, to help the clinician in finding appropriate strategy to improve the gait recovery of stroke patients. And for the methodology, the research started with the patient recruitment, and after that, the data collection will be held in the Vicon laboratory by using Vicon motion analysis system. And the data analysis, we are using independent t-test to distinguish between both group of subjects. And these are the criteria for stroke and control subjects. The stroke must be 6 to 12 months post-stroke, and the age duration is between 45 to 60 years old. They are able to understand English or Malay, and they are consented for the study. And the most important one is they are able to stand and walk within 5 meter walk away without using any mechanical device or any mechanical aid. And then for the control subjects, the criteria are same with the stroke subject, which the age range is between 45 to 60, and they also must be able to walk and stand within 5 meter without using any mechanical aid. And then the subjects in this research consists of 18 subjects, which 9 stroke and 9 control subjects. And then the experiment was conducted in Human Motion Gait Analysis Laboratory, UiTM Shah Alam. And then the research focuses on the lower limb of the subjects. During the experiment, 60 reflective markers will be placed on the participant's body, and then 8 cameras will be used. And during the experiment, participants are instructed to walk at self-selected speed within 5 meter. Then after that, the spatio-temporal gait parameters are observed. So as you can see here in the picture, this is how the marker are detected using Vicon software. This is the picture of a marker. Then the raw data is processed using Vicon software to obtain the spatio-temporal data, and then the data will be normalized to 100% gait cycle. And then the statistical analysis is used to evaluate the distribution of the data, which is by using Shapiro-Wilk test, and then further analysis using independent t-test to detect the comparison in gait parameters between stroke and control subject. For the results are focused on the spatio-temporal parameters, which are cadence, walking speed, stride time, step length, and stride length. From the bar graph shown, we can see that for the control subject, which is the blue color, the performance of the control subjects are greater in value as compared to the stroke subjects. Then the stroke subject has longer step time and stride time, and also they have shorter step length and stride length, and this result can be demonstrated by difficulties in walking as compared to the control subjects. And then the step length of stroke subjects tend to be asymmetrical for all steps, because stroke subjects are unable to generate propulsion during parietic leg stance, and this is due to ankle plantar flexion muscle impairments. And then this one is the result for independent t-test. From the results, we can conclude that there are 4 significant differences happen at cadence, walking speed, step time, and stride time, which is 0.000 and 0.002. Then the weakness of the muscles for stroke subjects result in slower walking speed compared to control subjects, and previous research found that stroke subjects has decreased knee flexion during walking compared to control group, and this condition is known as stiff knee gait, which is caused by weakness and abnormal muscle timing. Then the significant difference observed at cadence, walking speed, and for the conclusion, the significant difference observed at cadence, walking speed, stride time, and step time reveal that stroke subjects demonstrate difficulties in walking, which is generally caused by motor impairments and also muscle weaknesses. So, these indicative findings will help medical doctors and physiotherapists to find appropriate strategy in rehabilitation process. Also, the variation between all parameters may differ according to age, physical body structure, and also motor recovery level. So that is all for me. Thank you.